I'm really excited to be with you this day regarding the best study methods for medicine. Honestly, talking about the best is being speaking falsehood because there's nothing like best. There's no one way that works for each person, but there seems to be a generic way by which medical science should be studied. In many instances, students have had different ways by which they've studied. I remember back in our times, the study then was till daybreak. In other words, a lot of study materials are left during the daytime, and it is during the nighttime when people are sleeping, and then people crash onto all the materials that they needed to have studied during the daytime. Of course, it is very difficult to have studied when you were running from one lecture room to the other in order to pick up lectures. And so the reality hits you when you realize that you're having a test and then you're having to rush, and then you will not be able to meet up in between to study well. And so it is only reasonable to study late at night. The problem with that, however, is that the following day, instead of understanding what you're taught in the classroom, you're busy dozing off. And obviously, there's no way you can actually retain much information because the nighttime when you should have rested and there should have been a processing of learned materials into the memory so that it can be easily retrieved is lost. So that's the problem. Obviously, I remember clearly one of my lecturers then who was trying to speak with us about how we must study to pass medicine. And he discussed the fact that you have got to read the textbook of medicine at that time, cover to cover. Obviously, he was being wise, but that was just being economic with the truth. It would not be easy for a student to ideally read a textbook from cover to cover, but it can be done. Some did it. And the only point here then is that whether the study was well done or it was just to fulfill the aspect of reading cover to cover, some people did it and it worked for them, some didn't, it didn't work for them. Now, the point here is that study methods are different. With the internet and a robust information bank within the internet and so much publications and dynamism in medicine, it becomes important that the student keeps up to date with all the materials so that by the time they graduate, they would not be practicing things that may have been published in textbooks 10 years or more earlier. As we all know, that by the time a textbook is published, the materials contained in them may have actually been in existence or may have been utilized or relevant about many years backwards. And with the internet now, we have got lots of everyday changing evidence. And so lots of these would come to bear when you expose yourself to some newer techniques of learning. And I think the advent of multiple choice questions has given lots of an opening, a leeway of learning that students can always benefit from. It is called commonly as a pattern recognition by many students. But that pattern recognition has an advantage in the sense that you are able to identify areas of weakness, and then you would use the textbooks as well as the internet as a resource to identify those aspects of learning that you are deficient in. Additionally, it builds your confidence and gives you the ability to recognize what you will anticipate in the exam hall, thereby relaxing you so that you're not as agitated as someone who goes in there without much knowledge. I think those are enough reasons for any wise student to recognize how beneficial it is to give room to learning lots of things. And so in WorthyWorks, we actually have generated lots of multiple choice questions that you can use, particularly targeting people in developing countries, not only because it is mostly free or little charge to what you would be receiving. It also has got materials dealing with instruments that you are more likely to encounter in pediatrics, surgical instruments, as well as general medical equipments and instruments that you are able to see in short cases and orals as well. And these are downloadable. Some of them are the ones you can see on the side, and they are pictorial in a sense, and there are the questions related and linked with them, which you are more likely to encounter in exam situations. I think a wise student would always come and learn from this. Even if you think that our website does not have what you need, it would open your eyes to lots of other websites out there that can give you lots of information. But I encourage you that if you subscribe and you do not believe that we're providing the best of care or best of information to support your learning, get back to us. We will get back to you and understand how we can help you and provide learning support for you as well. I am grateful to all of you, and I am calling on all of you to subscribe to our website from today and get onto us. We will be eager to help support your learning and give you the best there is. Plus the fact that we will also give you some career guidance and counseling. As many of you as would be willing, we would enroll you onto our website, and we would welcome everyone, none excluded. Thank you very much for your time. Bye-bye.